Welcome, welcome, welcome. So exciting to have you all here. Happy State of the State Day and happy State of New York's Children Day. um, I'm Kate Breslin. I'm the president and CEO at Schuyler Center for Analysis and Advocacy. And we are just delighted to have you all here. We're delighted at the happy accident that the governor decided to select January 14th as her State of the State Day, well after we planned our State of New York's Children Day. So we appreciate that, Governor Hochul. Thank you. So my job is small but important today. I get to just do some introductions and then pass it over to our part of our entirely strong and competent team. So here at Schuyler Center for Analysis and Advocacy, we believe in a future in which every child across New York State thrives and every family has the resources they need. We take a data-driven approach to identify systemic problems, generate policy solutions, and hold government accountable. Our data book, which we are very excited to share with you, it's also online on our website, provides a data snapshot of the well-being of New York's children and families. So, what is the state of New York's children? The answer to that question depends on the zip code where a child lives, their parents' income, where they were born, their family makeup, and their race. But it shouldn't. Nearly 1 in 5 New York children are living in poverty, with many more in families working extremely hard to make ends meet. Every child in New York State should have access to ongoing health care, nourishing food, high-quality care when their parents are at work, and the resources they need to meet their basic needs, but also the other stuff, the extras like musical instrument for band class and sports equipment. Every family in New York should feel welcome and supported here, secure in knowing that New York is a place where they can live, work, play, grow, and put down roots. So we believe that having data is imperative to identifying the right solutions. And within this report, you'll find key data points and policy recommendations that we believe New York should be implementing to make sure that our children are thriving across our great state. And we welcome this conversation that we'll be having today. We welcome your questions, your suggestions, and the conversation that we hope to have with you going forward in the coming year. As many of you know, one of our special secret sauces is our partnerships. We know and believe that none of us can do this work alone, and so we really put a lot of energy and value into the trusting relationships that we have with many of you in this room and across our great state. So while we really do dive in and analyze the data, we're always eager to share it, to have conversations about it, to have arguments about it, and to partner with you to make New York the best state to raise a family. So we are going to have our team do some presentations, and I want to introduce members of our team who are here today so that when we finish, you all have a chance to chat and say hello and identify yourselves. So Adonich Mackey, if you can raise your hand. Thank you. Kevin Pang, can you raise your hand? Kevin's way in the back. James Farrell. James is here. Nicole Correa, way in the back. A lot of our team is in the back making sure everybody's doing what they're supposed to be doing. Hannah Burkle. Thanks, Hannah. Leah Montalto Rook. Shoshana Hershkowitz. Lara Castle. Bridget Walsh. Crystal Charles, Kari Siddiqui, and Dede Hill. And so please grab any of these folks at any point, today after their presentations, or anytime you see them around here or anywhere in Albany, or anywhere else. We really do have a fantastic, strong, eager, willing, enthusiastic team, and I'm so proud to be working at Schuyler Center with this team. So with that, I'll hand it over to Dede Hill.
Hi, thank you, Kate. Here, you can admire our team again. Isn't that a great looking team? We are such a great looking team. So thank you for being here today. So excited. So excited that this year, as Kate mentioned, Governor Hochul decided to follow our lead and hold her State of the State address on really what is State of New York Children's Day, right? So let's talk about what day it really is. And given that the governor has joined us today and making this a doubly great day, we are going to keep our remarks short. I'm just going to touch on a couple of key data points, and then we're going to move as quickly as possible into solutions, right? What can we do together to create the state that we all need and want for our kids? And I'll be doing that with this amazing team up here. Okay, so let's dive into some key data points. So first, just some basic facts about our kids. There are nearly 4 million kids. They represent 20% of our total state population. They are richly, beautifully diverse. 37% of our children in New York State come from immigrant families. 1/5 speak a language other than English at home. In addition, New York, over the last few years, has been welcoming many new immigrant families, including many children. So just in the period October of 2023 to the end of September 2024, we estimate about 33,000 children have newly arrived in New York State. Many of them are escaping poverty and instability and real violence in their home countries. I told you I was going to go fast. We're going to fly through this. Let's talk about how our children are doing. Kate already mentioned far too many New York children are experiencing poverty. Full stop. This number has hovered around 18% for many years. And to be clear, what we're talking about when we talk about 18% of New York children are experiencing poverty, we're talking about children who are living in families with income below the federal poverty level. And for context, that's about $32,000 a year for a family of 4. So as you can tell by that number, by that income level, these are families who are struggling every day to just meet their very basic needs. If we include children who are living in near poverty, so up to 200% of the federal poverty level, which is a closer measure of what poverty really looks like, then we're talking about 37% of New York children living in poverty or near poverty. And of course, unfortunately, due to historic, ongoing structural racism in employment, in education, in policing, and really all of the systems that we rely upon, Black and brown New York children experience poverty at much higher rates than non-Hispanic white children. And if we look nationally, New York does not measure well against other states. And here we are 2025. I'm still not used to that. We are more than 2 years after the state has passed the historic Child Poverty Reduction Act, in which the state has committed to cutting child poverty in half in a decade by 2031, which is fantastic. And yet, when we look at how we're measuring against other states, we're actually moving in the wrong direction. So right now, New York is 40th in the nation for child poverty. If we look back at 2022, we were 37th, and in 2019, we were 33rd. So there is a lot of work to be done. We say this a lot, and we say it a lot because we mean it, right? Allowing children to experience poverty is a policy choice. And unfortunately, it's a choice that New York State leaders have made repeatedly over time. And we know that that choice can have really serious consequences for New York children in all aspects of their lives, and sometimes these consequences are lasting. So, for instance, one way that this shows up is in the area of child welfare. Families experiencing poverty have a much higher likelihood of having poverty be misconstrued as neglect, and this can lead to entanglement with the child welfare system. And just being reported to the state central registry, just that can cause a family tremendous stress. And even if the report is unfounded. And as this data shows, in the vast majority of cases, over 75%, those reports are found to be unfounded. But the investigation itself can be terribly traumatizing. They often last more than 2 months. They involve intrusive searches of families' homes, interviewing neighbors, interviewing family members, and the children. And too often this happens without informing families of their basic rights, of their right to even know what has been alleged against them, of their right to consult an attorney. I'm just going to leave it there. Another way that experiencing poverty can impact children is their physical and mental health due to poor nutrition, barriers to accessing preventive and other health services, the stress that comes from experiencing deprivation. New York has made some excellent policy choices in this arena. We have chosen over time to invest in robust Medicaid and Child Health Plus coverage, and as a result, those two programs cover nearly 80% of children in poverty or near poverty. And CHIP and Medicaid, they offer comprehensive health coverage, including oral health coverage, which is often overlooked and so critical to overall health. But yet, due to a number of barriers, including a persistent oral health workforce shortage, and a shortage of providers accepting Medicaid due to low rates that are paid through Medicaid, fewer than 50% of New York children on Medicaid visited a dentist last year. So these are just a few of the ways that child poverty impacts our kids, experiencing poverty impacts our kids. We know how to end child poverty, and in this way, reduce the many negative impacts that children experience when they endure poverty. And let's look at this. I mean, I love looking at this chart. Actually, I love looking at the first part of the chart, and then around 2021, I am less interested. But The 2021 pandemic expansion to the federal child tax credit, what an amazing sort of natural experiment, right? With that expansion, we saw poverty in the nation and in New York State cut almost in half in a year. I mean, it was an extraordinary example of how policy can solve child poverty. Unfortunately, when that expansion was not extended, along with some other really important pandemic era supports, poverty resurged. And in fact, and this is using the supplemental poverty measure, it's actually surpassed where we were pre-pandemic. But the takeaway is that strong, refundable tax credits, they can do wonders in our efforts to fight child poverty. And New York has long been a leader, until recent years, in the area of having strong, refundable tax credits. We were among the early adopters of refundable tax credits. We have, in more recent years, sort of fallen behind other states because we haven't expanded those tax credits to keep up with rising costs. But there is good news. The governor, in her one of her announcements last week, in advance of the State of the State, she announced that she will be including a proposal in her executive budget to strengthen New York's Empire State Child Credit, our own refundable tax credit. And in really important ways. So we are really excited about this proposal. Among the aspects of her proposal are restructuring the credit to direct the maximum credit amount to the lowest income families, which is not the case right now. She's also proposing to increase the maximum credit from $330 to $1,000 for our babies and toddlers, for children under the age of 4, and that would be in 2025. And then the governor also proposes to increase the maximum credit for our children ages 4 to 17 from the maximum allowable right now is $330 to $500, and that would be in 2026. And the credit would also continue to be available to many immigrant families who often file their taxes with an ITIN number. So this is a really strong proposal, and we will be looking to build from this proposal as the budget is being negotiated. I'll also note we're really excited about the governor's proposal, also came last week, to expand school lunches, make them free to all children all around the state. We couldn't be more thrilled about this proposal. We know that children face hunger in communities all over the state, in rich communities, in poor communities, rural, suburban, urban. Regardless of the community, regardless of the reason that a child does not have lunch, they should be able to get lunch at school. And this proposal comes at a really important moment, a moment when many of our immigrant families in New York State are starting to pull back from social services. There's a lot of fear that is being stoked by some federal leaders, and a real fear of taking up services that these families are fully entitled to. But there is a fear of showing up, filling out paperwork. And so universal programs like universal school meals couldn't be more important right now. Gaining access to child care assistance. This is another policy that's proven to help families move out of poverty and into economic security. As this chart shows you, look how life-changing gaining access to child care assistance can be for a family. before getting assistance, you could easily pay $36,000 a year for 2 kids in care. In some places, that's almost the price for 1 child in care. And if you're able to access child care assistance, you could see that bill drop to $312. This is, what this means to a family really can't be overstated. Unfortunately, there still exists real inequities in our system, and families who are excluded. Perhaps the most jarring is New York parents who earn less on average than the minimum wage are currently barred from accessing child care assistance. So these are families, these are parents who are small business owners who are barely paying themselves. They are independent contractors. They are folks working in the gig economy, often 2-3 jobs, and they are just not being paid really what they're worth. And then they have, that's how much I hate this existing rule. And they then they have this additional injustice that they cannot gain access to child care assistance. Our legislative partners, many of whom are in this room, championed a bill last year that was passed unanimously. Unfortunately, the governor vetoed that bill at the end of the year. We are looking forward to seeing this taken care of in the executive budget. All right. I can't end my remarks without mentioning the child care workforce, because we know that getting child care assistance, that's just half the battle, right? You can get child care assistance, you can figure out a way to pay for child care, but you still have to find a child care provider in your community with space to care for your child. And that is no easy feat. We have a capacity shortage in New York State, and that shortage is caused almost entirely by our workforce shortage. And the reason we have a workforce shortage is because our child care educators are paid too little. Average salary, $38,000. That is $20,000 less than the median salary that New York workers make. It is, I always get this wrong, how you say this, they earn less than 96% of occupations in New York State. They earn too little. And the only way that child care providers have right now to raise the wages of their very deserving workforce is by raising tuition on middle-class parents. And a few slides ago, we talked about how expensive child care is. Middle-class families, upper middle-class families, nobody can afford child care right now. So it is not an option to raise tuition. Governor Hochul, also in one of her State of the State announcements, and I'm sure we'll hear more about this today, she had some child care proposals. One was to invest $110 million in infrastructure, physical infrastructure for child care providers. And while this news is welcome, what is really needed is an ongoing investment in the child care workforce, in the human infrastructure of child care, in the lifeblood of child care. I got an email from a child care provider yesterday asking about this announcement, and she summed it up when she said, building more child care centers without the fiscal support for the workforce and operations is going to result in more empty buildings. Okay, on that cheery note. Oh my goodness, I'm gonna stay right here for now. Let's move to solutions. So here's how we're gonna do this. We're gonna have every member of the team up here is gonna share really briefly one transformative policy that they believe is critical to advance in the coming year, and they're gonna say, and why this year? Why is this the year for this policy? And then we're going to open the floor because we want to have a conversation with all of you. And I'm just going to start by just saying we need a permanent investment in the child care workforce. that's what we need this year. Krista?
Okay. I actually have two, but they'll be quick. Okay. So Dede touched on earlier how experiencing poverty often entangles families in the child welfare system, and that is one of our main focuses, especially because this is intertwined with disparities in who gets reported, who gets investigated, who gets separated. Um, and one of our solutions that we're really excited about for the budget is called the Child and Family Wellbeing Fund. It would direct some state funds directly into communities to be dispersed through a transparent and participatory process. So it's really acknowledging that communities already know where their strengths are, and allowing and providing an opportunity for the state to trust families by directing these funds, giving them the power to direct the funds where they know it will have the greatest impact, and help repair some of the communities that have been historically disenfranchised by both high child poverty rates and high interactions with the child welfare system. Dede also mentioned how families often aren't informed of their rights at the beginning of an investigation process, and one of the solutions that we're excited about for that is called the Family Miranda Rights Act, which would require caseworkers to do just that as soon as they have their first meeting with families. This has actually already been implemented in Texas. I repeat, Texas. And the early feedback does indicate that it has helped de-escalate and shorten investigations.
Hi, everybody. My name is Kari Siddiqui. I'm a project director at Schuyler Center, where my work focuses on our child poverty reduction work. And I also coordinate the New York Can End Child Poverty Coalition. You can grab stickers that say, "I believe New York can end child poverty" in the back, and I encourage you to stick those on your water bottles and wear them around the Capitol. I am most excited about the potential for an expansion of the child tax credit this year. And Dede touched on all the things I was going to say, so I don't have much more to say except for that, you know, I think that this is really the year where we can start the expansion of the child tax credit, build it to something stronger, and really leave it with the potential to continue to grow and expand. An expansion of the state's child tax credit is one of the major recommendations of the state's Child Poverty Reduction Advisory Council, which is tasked with making recommendations for how the state can reduce child poverty by half by 2031. And so we're now heading into our fourth year of that timeline, and really need to begin to make progress towards our child poverty reduction goals. And as Dede shared earlier, we know that that a strong refundable child tax credit that is targeted towards our lowest income families, but also available to, you know, a wide swath of families who are facing affordability issues here in New York State, that is one of the best ways to reduce child poverty. We saw it during the pandemic, and hopefully we'll see it again when New York expands the child tax credit this year.
All right, hopefully that turned it on. Technically inept. I'm Bridget Walsh. I am Senior Policy Analyst for Health and Public Health at the Schuyler Center. And in order to be brief, I'm going to skip why early childhood oral health is very important, but I'm happy to talk to anybody at any time about the importance of early childhood oral health and oral health for pregnant women and actually families. Interestingly, I'll just say this. One of the reasons we focus on oral health is because it doesn't get as much attention as many of the other healthcare issues, and yet it is critical to the development of children and their health, and it is often overlooked both by parents and providers as something that we need to be focused on early. But happy to talk at length about that. Our focus has always been on prevention. It's almost always preventable. And so we want to make sure that there's access to community water fluoridation, that fluoride varnish applications are happening on children, that they're getting early assessments and referrals to treatment if they need it early. So this past year, we have undertaken a project to look specifically at the oral health workforce. We spent the entire year on it, and we have a very extensive report that will be coming out in the next week or two. It's just getting its final reviews. There's 3 areas we think are going to be important to increasing the number of providers. One is allowing the current workforce to do more. That's the fastest way to get more services to people. And so that will include things like scope of practice changes, allowing medical and dental providers to do more in practice in more areas. Another area we're looking at is how do we increase the number of people actually doing treatment? So that includes things like implementing the interstate compact for dental and dental hygiene, right? Allowing providers from other states to practice in New York. But it also includes allowing new providers to come into the system, like say a dental therapist, which is a new profession that would be allowed in New York. The third aspect that we're focusing on is how to get more providers to serve Medicaid patients and also in underserved areas like many of the rural areas in New York. So that will include things like reimbursement increases, also technical assistance for providers who may want to join the Medicaid system but don't know anything about Medicaid. They're often afraid to join because of the paperwork involved and the systems issues involved. So this is a national problem, so states all over the country are starting to figure out how do they address the oral health workforce. So we're going to have some very specific, actionable strategies that are going to be coming out in the next couple weeks. But a couple I'm going to focus on today. One is increasing the scope of practice for dental hygiene. I know there is a bill that's been worked on in the last few years, but we feel that that is going to be a very important way to get more services out into the communities very quickly. The other one, and we'll say this again, is several years ago, the state passed a law that would require medical and dental professionals, all health professionals, on their re-registration for their license to provide the state with data about where they're working, how they practice, the populations they serve. That law has never been implemented. There's been no funding to actually implement that law. So when we're trying to understand workforce, we still don't know where providers are, how they practice, how many they are, and you know, if they're practicing full-time or part-time. So it's really hard to still get a handle on the workforce when we haven't yet implemented that law. So those are 2 things that we can be doing immediately.
Good morning. I'm Laura Castle. I'm the coordinator of Medicaid Matters New York. Medicaid Matters is the statewide advocacy coalition representing the interests of people who have Medicaid for their health insurance coverage. And Medicaid Matters has the benefit of being housed at the Schuyler Center. So I'm part of this awesome team. Medicaid in New York is big. I'm gonna cheat. Everyone else focused on maybe 1 or 2 things. I'm going to speak more generally than my colleagues have about the importance of Medicaid. Medicaid in New York is big for all of the right reasons. We have a strong, big program because we cover a lot of people and a lot of services, whereas we don't have to do that. We have chosen over the years to have a strong Medicaid program. Is it perfect? Of course not. That's why I have a job as the coordinator of the coalition to bring the advocacy that we need to have a strong program. New York identified the reason that we got here, one of the ways that we got here is that New York over the years has identified that people were falling through the cracks. There were people who without Medicaid otherwise would have had no access to health care, and that's why our program is what it is today, and we're proud of that in New York. We need to now build on the momentum that we have here in New York. One big win that was just implemented at the beginning of January is continuous eligibility from birth to age 6. That's a really big deal. That means that whenever a child comes into the program, whether it's birth or a little bit after, all the way until they reach kindergarten, they don't have to go through the paperwork burden of re-enrolling in the program. They stay in the program. Most children, the vast majority of children, if they fall out of Medicaid, it's because of a paperwork barrier, not because their family is no longer income eligible. So this is a big deal. We need to build on this kind of momentum. This happened due to a lot of work from a lot of people in this room. I'm seeing many of you. And we need to continue to build on this type of success. One of the other areas that provides us with an opportunity to address the needs of children and families is the Medicaid 1115 waiver, which is now being implemented. It's also called the New York Health Equity Reform Waiver. And I'm sure that you all are starting to hear about it. Legislators and staff are starting to hear about your communities being contacted, community members being contacted now about the implementation of this waiver. The focus is on connecting people through Medicaid to social services to address their health-related social needs. We need to make sure that in this waiver, the needs of children and families are also addressed. This presents us with a very big opportunity. We must not miss that opportunity. We have an obligation to make sure that the 1115 waiver works for everybody, including especially children and families. So I just want to end by saying that it is our obligation as a state to make sure that Medicaid can remain strong in the face of what we may see coming to all states in the next few years. And we have a strong, rich history to build on. We need to continue to ask ourselves who is falling through the cracks and make sure that they have what they need through the Medicaid program. Thanks.
You to ask us some questions. I mean, what an amazing group we have here, right? Like, amazing expertise. And so I'm going to shift to slides, to an inspiring slide here. Okay. Right? We know how to end child poverty. Oh, and I'm going to ask Shoshana to come up, and Shoshana is going to play talk show host, and she has so many talents. So are there questions? We're ready.
Apparently you nailed it.
I know.
My favorite part of the day.
Good morning, everyone. Gail Gahagan Pratt with the Office of Children and Family Services. Thank you all for the information that you've shared, and we'll definitely be following up. I just wanted to hear a little bit more, Crystal, in regards to the Child and Family Wellbeing Fund that you mentioned as you were giving your remarks. Just trying to appreciate sort of, how this would look operationalized and any other details you can provide. Thank you. All right. So the Child and Family Wellbeing Fund would take about $30 million of state funds and have a managing agency that would work with a nonprofit to do the community work in about 10 communities across the state that have the highest child poverty rate and child welfare involvement. So go through like reports, I think the highest reports to child welfare. And it would through that, working with the community process, the communities would decide which projects, programs, or other initiatives in the community would get grants, essentially. So that's a kind of a little bit more detail there, and we have some more information I can share with you.
I think a lot of the recommendations. Oh, I'm Assemblymember Farrah Forrest and mommy to one 3-year-old going on 13. I think it's not necessarily the questions, but just the recommendations, even the policies that I didn't know that we even did this whole thing 0 to 6 automatic enrollment. Like, that's amazing to not fill out one more paperwork. But also the idea of somebody encountering ACS and it's might be over something over your child came with shoes, sandals today in the middle of the winter, and that be a question, but not punitive, but can we help you would be actually and the parent being notified that they can ask for help at this time. So I don't think the uncomfortable silence is just so no-brainer. I do have one thing to share in my last trip to a national conference for state legislators, and the child tax came up. And one of the biggest things is I don't want to pay for somebody else's kid. And the part that I'm like, well, if you don't want to pay for them, I'm paying for them. That's no problem. I have them. But you get upset when they come into the retail store and they do theft. Or you get upset because they're running around at the mall. Or you get upset for whatever reason someone might look at a 12-year-old and be upset. But there's this idea of this shared collective. And these are people that are, I know, well-meaning people, but they're just this idea that this is not my problem, this is your problem. I just, while I'm hearing this, I'm also knowing the fact that on the national level, even the proposal to even let's recommend to talk about this was shut down. And that was very discouraging this year. There's other things that were great things we did, but that was very discouraging.
Here I go, getting the steps.
Hi. Good morning, everybody. Wow, that's very serious. That'll wake you up. Good morning, everybody. Hi. So I would ask Dede if you can just to hit on the importance of funding the child care workforce in the context of Governor Hochul has invested over the last couple of years. It was a huge investment, billions and billions of dollars, but our child care system is not where we should be. And the single reason is because we're not paying our workforce. Could we talk about that a little bit more so everybody understands that that's the battle that's coming this year? Yes, it's a softball question. I'm setting you up. Go ahead.
Yeah, I was just going to say, I think you just nailed it. There's not much more to say. No, I think it is. First, it's important to recognize that New York State has made tremendous strides. The state investment in our child care assistance program has quadrupled since 2020. We have expanded income eligibility for the child care assistance program to the tune of, there are now more than, I always get this number wrong, but more than 300,000 families are newly eligible for child care assistance. So if we go back about 3 years, the income, the cap was 200% of the federal poverty level. Then it was 300% of the federal poverty level, and now it's 85% of state median income, and that is about $109,000 for a family of 4. So we have all of these families newly eligible for child care assistance, which is something to celebrate and to be really proud of, and we are very proud of. Gaining access to child care assistance means nothing if you can't find a child care program that can care for your child. And that is the wall that we are coming up against. And we talk, ultimately the solution, and the governor just last week in her remarks on some of these child care proposals, she, restated her commitment to moving New York State to universal child care. I know here in this room, Assemblymember Hevesy, Senator Brisport have been leading the charge for universal child care. And so there's a lot of interest in getting there. And the sequencing of getting there matters. So the next step, the biggest hurdle, the rock we need to move this year is investing in the child care workforce, and it has to be public funding, because like I said, the only other way to raise their wages is by raising tuition, and we know that's not an option.
I'm coming back.
Oh, she's here, she goes.
I got you.
The follow-up question I have for that is like, so then how do we, so it's not just getting them, you have to train them. Did the Schuyler Center do anything about like how to build the pipeline? Like, does New York State's policies, 'cause I don't know, really emphasize that child care, early development is a must? These are the things I think we're skipping a couple of steps here, right? I don't know.
Thank you so much for raising that, and it is true that there are this is a complex issue, and again, as I said, it's sort of sequencing matters, and so the biggest issue, right, like the first step is retaining the current child care workforce, right, and they are trained, and many have years of experience and are just fantastic at their jobs, and many of them can't afford to stay in their jobs. So step one, retain and recruit those who are ready and able. But right on the heels of that, and there are many, luckily we are working in partnership. It's not just Schuyler Center. We are part of the Empire State Campaign for Child Care, which is a statewide campaign for universal child care, and we have a very deep bench. And we are working with a lot of partners who are like the next step is creating a career lattice, we like to call it, that thinks holistically about what it takes to be a early childhood educator, and really valuing, because it's not just diplomas and degrees, although that is super important. It's also language ability. It's also cultural competence. It's so many things, and we are building that. But first step, we need to raise wages. And I will just also say we cannot get people to enter the field, to go to community college or go to college and get and seek those degrees, because no matter how much they love children, if they see what their earning potential is, they realize they can't do it. They turn away. So we have to change that potential right at the outset.
Hi, my name is Cody Bloomfield, and I'm with Hunger Solutions New York. We're the co-lead of the Healthy School Meals for All New York Kids Coalition, and we're definitely in a moment of celebration right now. It's very exciting. Just like the announcement of the CTC expansion, it's a moment to also be excited and grateful for the work that's been done. Dede, I really appreciated what you had to say about Healthy School Meals for All, providing some support in terms of immigrants turning away from federal nutrition programs and other federal programs because of this like chilling effect. So thank you for bringing that up. I think that's really important. I did wonder if you had any comments or words of wisdom around how to better support immigrant families as they deal with this new chilling effect from the federal administration. Thank you.
I'm sure there are people in this room who have more thoughts and insight on this than I do, but I will say, I think one of the positives, and Dede mentioned this, of the CTC or the Empire State Child Credit, as we call it here in New York, is that it is available to immigrant families who are filing their taxes with an ITIN number, which is not true of, all benefits. So I think, that expansion is really promising in that respect, and there will be work to do in terms of getting folks to file their taxes so that they can receive that. So, we're kind of thinking about both, making sure that we get that expansion, and then once it's expanded, how we do that outreach to make sure that those families who might be hesitant to interact with public systems are filing their taxes and getting that benefit that they're eligible for. And I think, we're all thinking a lot about kind of how other systems interact with immigrant families and what kind of the protections are. And I know you all are thinking about that as well. I don't know if anybody else on the panel wants to add anything to that.
I'll just mention that we are already hearing about the chilling effect in the healthcare space. I have heard from community-based providers, health center representatives, managed care plans saying they have had calls from people saying, I'm not coming for dialysis, or I'm not bringing my child for their well child visit. And there have been some managed care plans that have already had people call to say, I'd like to drop my coverage. So this is real, and it's happening now regardless of what may happen in the next few weeks and months. People are already retreating to the shadows. And I will say we are currently, Medicaid Matters is part of some organizing about this issue in healthcare and identifying ways that the healthcare system in New York can be a safe place for people, where hospitals and other providers will outwardly say people are welcome here regardless of their immigration status.
Hello, my name is Shannon Owens. I am Legislative Director for Assemblymember Lunsford. My question was just a quick one on the child care fund to increase child care worker compensation. Just really great, premise, practical, of course. And I was just wondering, so with the 1.2 billion there, if you had any estimates on how that would impact the average, I think 38,000 was the compensation reference. So I was just wondering if there were any statistics on that. Thank you.
Thank you for that question. Yeah, the budget request that we are making is for $1.2 billion, and that translates into supplements that average about $12,000 a year, and so that's still, so the median salary in New York State is about $69,000, so it still does not bring the educators anywhere close to what they should be paid, but we think it's a really good start, and we modeled the proposal to some degree on the experience of Washington, D.C., which they implemented a workforce fund about 2 years ago, and they have paid out their enhancements have been about between $10,000 and $14,000 a year, and they've seen some really positive outcomes as far as stemming the flight from the field and starting to build a pipeline. So.
Hi, my name's Abby Evans. I'm from the Office of Intergovernmental Affairs in the State Senate. And I had a question, I think probably for Laura, but anyone, maybe Bridget as well, regarding school-based health centers and the carve-in with Medicaid. Do you have any thoughts on that you can share?
It only works if you don't turn it back off. You can hear me, right? Yeah, okay. So this is an issue that has been discussed for 10 plus years, I believe. The Medicaid managed care in New York State went through a transformation with the Medicaid redesign team in 2011. And part of the Medicaid redesign team's work included a plan to bring everything in Medicaid into mandatory managed care. So that means rather than Medicaid operating on a fee-for-service basis, meaning paying for services as you go, Medicaid would be administered through managed care plans, which are insurance companies. And this has been an iterative process over the course of many years, and school-based health centers was one that they were one of the things that as part of the MRT was slated to go into Medicaid managed care, and that's why we've been talking about it for so long. We believe, along with many other advocates, including parents and students themselves, and in addition to the school-based health center providers, that this is a specialized program that ought to stay out of Medicaid managed care, because managed care works really well for most people. Managed care doesn't always work well for people who get their services in a different way, for people who need more than just routine preventive care. And this is a very specialized program. It's a very specialized service that we think ought to remain out of managed care, to keep it out of the complexities of rate setting and payment and service denials and all of the other things that come along with the way managed care works in general. And so I know that this is an ongoing discussion. It's slated to go into managed care. There's this thing where we say carve in, carve out. It's slated to be carved back or carved into managed care April 1. And there's a lot of discussion continuing about preventing that from happening, or at least delaying that from happening, so that we can continue to examine whether this would work or not.
Thank you.
Yeah, I just want to add what's particularly interesting about this issue on the dental side is if you close a dental clinic, it's a lot harder to start it again once you've closed it, because there's equipment, there's water, there's sterilization. It's a more intensive process. So if they decide to close the dental clinics that are in schools, and let's say a year or two from now they say, we changed our mind, we want to do this again, it's a lot more expensive and intensive to start those clinics again. And so on the dental side, it's a little, there's even more concern that if these services go away, they will never come back because of that investment.
I know there are two more people who have asked to speak.
Hi everyone, Ryan, Feeding New York State. Just want to thank you and the entire team at Schuyler Center for not just for your work on child poverty, but also treating the issue with the urgency that it deserves. One quick question is about, of course, the 2021 federal child tax credit expansion. One of the defining features was recurring monthly payments. How are you all thinking about frequency of payments as the state considers efforts to expand the CTC?
Thanks for that question. So just to clarify, back when the federal government expanded the child tax credit, as Ryan said, in addition to increasing the amount and expanding the population who was eligible, they also made monthly payments to families, which were really helpful. And I think from our perspective right now, we like, I guess I would say, like, if in terms of priority, the idea is good, it makes sense. At the same time, our priority right now is getting it increased. So getting it, as Kari talked about, sort of first priority, making sure that it's available to the lowest income families, and also that the amount is increased. We'd love to see a time where it could be paid monthly. Our understanding from having conversations with our Department of Tax and Finance, who have been fantastic on this issue, is that there are a lot of technical reasons that might be hard. So Not to say it's not important, but just that it's not as big of a priority as getting it to the lowest income families and getting the amount increased.
Hi, Andrea Smith. I'm asking a question on behalf of, as a board member of the Boys and Girls Clubs of the capital area. So related to the construction fund for childcare, is it possible to prioritize two areas that are currently doing well and but struggling with some of the regulations, and specifically the Boys and Girls Clubs received through the Office of Children and Families, thank you, a significant amount of UPK granting. But the convergence of the OCFS regulations with the school regulations, they're running the UPK programs and they have to comply with both, and the capital costs of meeting the child care standards for the UPK programs is quite high, and the school districts obviously don't have the space to run the UPK program, or they'd be doing it in the schools. And so it's great that nonprofits can subcontract, but the construction fund might be able to be prioritized to actually help us expand UPK.
There was so much there. Yeah, I mean, I think the short answer is we're looking forward to hearing more about the governor's proposal, maybe in a few hours. I will, just in the press release, and this is not what you were asking, but in the press release, there was an indication that this capital fund will be available this time for family-based child care providers, which was not the case last time. And so that's a welcome change or improvement. But I think some of these other issues, they're such important issues, and the integration, the barriers to smoothly integrating funding streams like pre-K, child care, Head Start, these are barriers that we are always asking and working to get the state to deal with at the state level or at the county level, and not put it on individual child care providers to have to try to navigate these incredibly complex systems. There is a task force or council or advisory group that is meeting right now to look at child care and pre-K and how they can interact in more positive ways to benefit communities, and so we welcome those conversations. But yeah, let's keep talking. And with that, I am going to just close us out, and I would really urge everybody to stick around and talk to our amazing team who are all around. I just want to reflect on the conversation we just had. We are entering a moment of really profound uncertainty, and that's a little scary. But I think it's also a moment for New York to unapologetically lead, and to lead with our children first and foremost, top of mind. I think that some of the governor's, pre-release State of the State proposals that we've talked about, some of them are not just good, they are potentially transformative. But they really just represent a start, right? This is a moment where we shouldn't stop with these proposals. We shouldn't even slow down. We need to go full speed ahead toward creating a New York where all of our children can thrive, where our families feel safe and welcome, all of our families, where our families can put down roots, and where their children will put down roots, and we can hang out with our grandkids, right? This is what we're all striving towards. So stick around, have some coffee, talk to us, and look forward to the work ahead.